Hi, everyone. We'll get started in just a minute or so. All right, it is 1:03. We have a good sized group, so why don't we get started? So good to see everyone. It's been far too long. Welcome to the July meeting of the Endometriosis Working Group. I want to get started like we always do, but first, just want to let you know we are being recorded on CTN today. And now I'd love to go around and just do some brief introductions. So I'm Jillian Gilchrist, State Representative and Chair of the Endometriosis Working Group. I'm just going to call on the little boxes as I see them. Heather, go right ahead.
Hi, it's Heather Guidone from the Center for Endometriosis Care. Great to see everybody. Hope you're all having a great summer.
Thank you, you too. iPad 74. I don't think she knows that that's what it says. I'll come back. Rachel.
Hi, everyone. I am new here. My name is Rachel Barsano. I know Arlie Cole here for quite some time, and I'm very grateful that she was able to make this connection for me and so that I could be here today. I was diagnosed with endometriosis back in 2023, and I honestly owe a lot of my gratitude towards Arlie for helping me advocate my way and navigate the healthcare system. Um, I'm studying global health and gender and women's studies at the University of Wisconsin in Madison, though I've lived in Connecticut my whole life. So I really am just excited to be here and a part of this conversation. My conviction honestly just continues to grow, especially in this ever-enduring time, that the only way forward is honestly to change the system. So I'm really very excited to be a part of the conversation on policy and honestly just be around like-minded, strong people. So thank you for having me here today.
Thank you so much. Thank you for being here. Jenny, go right ahead.
Hey everybody, I'm Jenny Cole. I'm the project manager for the Menstrual Equity Grant at the Diaper Bank of Connecticut, and we are also the Connecticut chapter of the Alliance for Period Supplies. Thanks.
Great. Jasmina.
Hi everyone, I'm Yasmina. I'm the Androids Program Manager and I work at the Jackson Laboratory. Very happy to be back here.
Great. Cassidy.
Hi, my name is Cassidy. I'm a clinical research assistant at UConn Health and the clinical coordinator for the Endometriosis program.
Wonderful. Janet.
Good afternoon, everyone. Janet Stolfi Alfano, CEO of the Diaper Bank of Connecticut. Nice to be with you today.
Good to see you. Dr. Luciano.
Hi, I'm Danielle Luciano. I am an OBGYN and minimally invasive GYN specialist or endometriosis surgeon at UConn Health and co-director of our EndoRise.
Wonderful. Bridget.
Good afternoon, everyone. Bridget Aliaga. I am a behavioral health program manager with DMIS Women's Services.
Wonderful. Lisa, sorry, you got a bite in your mouth?
Murphy's Law, right? Yes, hello everyone. I'm Lisa Ray. I'm Director of Government and Community Relations with the Jackson Laboratory, and I work closely with the Endorise team.
Wonderful. Laura?
Hi, I'm Laura Weisman. I'm an endo advocate and patient. I was recently diagnosed also in 2023. So I'm just happy to be here and be amongst all you.
Wonderful. Welcome. Glad to have you. Carol?
Hi, everybody. Carol Johnson. I'm the CEO of Uter and Kind, and it's really great to see everyone. Happy summer.
Happy summer. Caroline?
Hello, I'm Caroline. I'm a postdoctoral associate at the Jackson Laboratory. I work under Dr. Elise Courtois, and I actually study pain symptoms in endometriosis.
Wonderful. Thank you for being here. Holly?
Hi, I'm Holly DeAndurand. I'm the California Director of Extrapelvic Not Rare. Extrapelvic Not Rare is headquartered in Washington, and we have chapters in California and Connecticut.
Fantastic. Thanks for being here. Dr. Courtois?
Hello, everyone. Really nice to being back here. Very happy to see all endometriosis working group faces. So I'm Elise. I'm a researcher at the Jackson Lab. So we work on endometriosis, trying to understand the biology of a disease, and also working with Endorise with some of the colleagues you also have around. Nice to see you all.
Nice to see you. Sam?
Hi everyone, I'm Sam. I'm a nurse as well as a patient. Patient of pelvic as well as thoracic endo, and I'm just excited to be here and learn about the advocacy work and how I can help.
Great, thank you. Dengo. Did I get it at all?
You got it. My name is Dengo Umilelo. I'm the summer intern with Reproductive Equity Now, and thanks for inviting me.
Great, thank you for being here. Representative Kennedy.
Okay, good afternoon. I'm having trouble with my computer ever since I got this new one sent to me, but I'm glad to be here. Continue working with all of you guys. I think your work is instrumental for all of our young and older women, all of our women in general. So glad to be here, and I look forward to seeing where we're at and how we're moving forward. Thanks, Representative.
Great, thank you. Good to see you. Arlie.
Hi, sorry I'm not showing my face. I'm multitasking today. But Rachel, it's great to see you on here. I'm so glad that you have joined us. And I am Miss Endostood. I am a patient and health advocate, and really happy to be a part of this group.
We're happy to have you. Thank you.
Thanks.
Liz.
Hi, everyone. Liz Gustafson. My pronouns are she, hers, and I am the Connecticut State Director with Reproductive Equity Now.
Wonderful. And did I miss anyone? All right. Then we're going to start as we always do. I'm going to give some space for anyone who wants to share their experience with endometriosis. Okay, then we are going to jump into the first thing on the agenda, which is a legislative update. I preface this, there's been some back and forth and on the interpretation of what was done in the state budget. And so that's why I'm taking my deep breath before I would have just said to you, great news. It does appear, though, that there's great news. So we were able to get additional funding for the endometriosis biorepository into Connecticut's state budget. For those who recall, for those who don't, I'll just give the background. This group was instrumental in pushing for an endometriosis biorepository, which is a partnership between Jackson Laboratory and UConn Health You will hear from EndoRise, which is the broader program of which the endometriosis biorepository falls underneath. At the end of this meeting, we'll get an update from them. And we passed that in the fiscal year 24 and 25 budget cycle. And so they were awarded $735,000 each year to really start up the biorepository. And so based on the tremendous work they've done, we wanted them to get an additional $280,000, which would bring them up to a little over $1 million a year. We have confirmation from both the Office of Fiscal Analysis and the Office of Policy and Management that that was the intent in the budget and that the money is there. Ideally, by next meeting, we'll be able to confirm that the money has been distributed. So it's good news, but we are still. So here's a little lesson in advocacy and policy. It doesn't end when you pass the bill. You gotta keep working at it. So we are continuing to work at it to ensure that that money gets exactly where it is supposed to go. And so we are optimistically excited that we were able to get that increase. Additional budget legislative session updates. We did make further progress than we ever had with regards to fertility care. We've been pushing for a while in the state of Connecticut two different potential policies. One was kind of a, go for everything we want, and it would have required an expansion of fertility coverage in the private market as well as Medicaid coverage of fertility care. This year, we went for a more modest, but still beyond what Connecticut currently covers for fertility, and just Medicaid coverage. And unfortunately, it had been whittled down to a study, and we didn't even get that over the finish line. Now, what I plan to do is come September, pull a work group together regardless, to have those conversations. Some of the sticking points were storage with fertility, with the thinking being, and now you could see how this would be an issue based on what's going on federally with Medicaid. The concern being that if Connecticut covers storage, what if someone is kicked off Medicaid? I did get confirmation, and please, anyone who knows more about this than me, correct me, but that usually a storage facility would let someone know and there'd be like a 3-month window. But yes, in the end, they would destroy the contents that they have at that storage facility. And there was just a fear that that wouldn't go over so well. So we need to be thinking through that and what that policy looks like. But I just want to, put it all out there because I think it helps when you know what the pros and cons were. I was very adamant, and I think there's finally a level of understanding that we're not just like, so currently in Connecticut law for the private market, it really is specific to cancer, which is incredibly important, but really was pushing them to have a broader understanding of what we're getting at in terms of folks who have endometriosis and that you might not have an official diagnosis. And so still trying to work through how we could ensure that folks would be able to get the fertility care they need if they are experiencing a disease other than cancer. So just to give you some of the context around that conversation, and like I said, certainly I'll keep you posted as we start to have those conversations in September, because even though we know what's going on federally right now, I think Connecticut could continue to be a leader and should be pushing for the things we want, even when the federal government is doing what they're doing. So that's where we stand there. I asked Heather, and she generously offered to jump in and give us a federal brief update on what's going on and how it's impacting the endo world. So thank you, Heather.
Of course, of course. Can everybody hear me okay? I had to use an external mic today because, everything just falls apart when it's time for meetings. Okay, so this is, this may be a little older, or maybe some preliminary information from what's coming, because we do have another call on appropriations tomorrow, in terms of the NIH and so forth. But what I can tell you, sort of writ large, women's health and or research grants generally, When we're talking about as of June, the number was at 2,282 NIH grants that had been awarded to U.S. institutions were terminated and not reinstated. That's a really monumental number. When you look at it in terms of absolute dollars and cents, it's almost $3.8 billion. Now, the important part of this is, aside from the loss of funding, the important part is that the majority of the terminated grants, over half of them, had been awarded to U.S. medical schools and hospitals. And that portion alone represented $2 billion in lost funding. 2/3 of that were for research and development grants, and 38% of which were research and training. Now, what does that translate into the real world? That translates into less researchers doing less research, right? And in that comes endometriosis, which is already under-researched and underfunded. So as far as the grants that were not reinstated and the lost funding, we're looking at taking very big hits at medical schools. We're looking at hits in the research and training, and this is really impactful on state level as well. This is not just some sort of ethereal federal funding out there in the ether. For example, if we look at Connecticut alone, Connecticut lost $853,727, almost $1 million in research and career development grants. So it doesn't take a huge leap for me to kind of jump from that number to things like EndoRise and other places that could stand to get substantive federal funding. So that's a little bit frightful. Beyond that, in terms of structure and dollars being applied to NIH programs and so forth, according to the most recent data, we're looking at a 39.3% decrease compared to fiscal year 2025 in terms of funding for next year. Now, 39.3, what does that translate into? Only 27.9 billion. And again, I'm throwing out these numbers, in billions and millions here. But again, that's a 40% decrease from what we're looking at. And more to the point of that, they're also looking to restructure the NIH itself into 8 institutes and centers. It would be 5 new consolidated institutes, such as the National Cancer Institute, the Institute of Allergy and Infectious Disease, and so forth, the National Institute on Minority Health and Health Disparities, looking into combining and taking them down, and also putting a 15% cap on facility and administrative fees. Again, this all translates into less research funding. Now, the one beacon of hope is that the administration has restored funding to the Women's Health Initiative study that allegedly was flagged, maybe because it had women in the title. I can't say that for sure. The long shot of it is that the funding has been restored. I can also tell you, without too many specifics, is that endometriosis is being added back in to the Department of Defense Congressionally Directed Medical Research Program again. I cannot tell you what the studies are, and I cannot tell you if they will get the funding. It is my hopes that we can get some really good efforts funded through there. And the lawsuits continue. I'm not going to really talk about the Medicare, Medicaid issues, but I can tell you there are many women's health organizations, Planned Parenthood, various medical organizations, really going after, some of these statutes, some of these proposals, some of these implemented budget figures. We have meetings 46 times a week, with ad hoc groups and friends of groups and advocacy coalitions. And we continue to submit congressional requests to appropriators to continue investing in women's health, specifically endometriosis for me, but also the larger extent of the NIH, because now we're looking at 2026 appropriations. So that's kind of it for now. I mean, there's not a lot of fantastic news in there, but it's not hopeless. There are enough of us, collectively us, out there in the world who are really safeguarding and trying to protect women's health and endometriosis research. And, we're not going to stop. We're going to keep going. So we'll keep up the effort, and I'll keep everybody posted to the extent that I can and am permitted to. And with that, I'll throw it back to Representative Gilchrist.
Thank you so much, Heather. That's very valuable information. Appreciate it. And then one more legislative update. So you just heard the federal update. I gave the Connecticut state update. Just to flag for folks, some good news coming out of the state of Massachusetts. They had a public hearing last week on two bills that would establish their own endometriosis task force. And so did submit testimony in favor of that. And so if we can all keep our fingers crossed and wish them good luck in Massachusetts, it'd be fantastic if they continue to push this work as well. So great news. Any questions? Oh, I see. Lisa, go right ahead.
Just a question in relation to that. Who's driving that effort in Massachusetts?
They have some legislators and there's some organizations. Reproductive Equity Now, which is Connecticut-based, also has Massachusetts folks. And maybe even Liz, do you know what other? Oh, All Paths. Thank you, Liz. All Paths. And then they do have some champion legislators who wanted to do stuff on this.
Lisa, I can put you in touch with Kate if you want from there.
Yeah, that'd be great. I think it will be touched upon in the update from Endorise, but we're looking at doing a fall forum. It might be interesting to reach out to them and maybe include them in some aspect of it. So thank you.
Perfect.
Wonderful. Great. Any questions on anything we've discussed thus far? Or comments?
Heather, hi, I'm Georgie Kovacs. Heather, should I bring up what I've been working on? Should I share?
That's entirely up to you.
Right. So I was so happy to hear the news in Massachusetts, and I would just because of the fabulous group that's here, and I've connected with some of the EndoRise team members a couple of months ago and have been watching these meetings. So I'll just introduce myself. I'm Georgie Kovacs. I've worked in healthcare my whole career, and I've been a women's health advocate, consultant, et cetera, in this space. And my passion has always been endometriosis. I know Heather well, and I've interviewed so many experts in this space. And I've spent a long time trying to figure out like how do we solve so many of these issues in women's health. And I know that, with EndoRise working specifically in Connecticut, I see there's opportunities globally to leverage so many of the experts in endometriosis to start pooling resources. So we're working in a unified front globally. And so I had this crazy idea to create like this global endometriosis working group, so to speak. There's a lot of in pharma, there's actually a use case where the heads of R&D of pharma were really successful in doing this to optimize clinical trial costs and timelines. And then also there's a bunch of use cases. I've put together a slide deck where it talks about other use cases in healthcare. Obviously for women's health, breast cancer is a huge one, where we went from it being an embarrassing, shameful thing to have to it's transformed, right? And just given my expertise, I really see like bringing together all the people that are doing this. And I've had many conversations with people, and I more just wanted to share. I'm still gathering data. Like right now, the way I'm doing it is through a survey, so to speak, that people fill out. So I can just gather what are people doing, what do you think are the priorities for endo? And I'm not at all trying to like take over the call. I'm more just like acknowledging there's so much happening. So how do we start centralizing it? And I'm keeping fingers and toes crossed. There's ways to get funding to make it happen because I cannot do this in my free time. But I'm genuinely just trying to scope out who's doing what in endo. Because I do see how these efforts in the States are wonderful, but we still need to have that global, like, what are the researchers doing around the globe? Like, I spoke to one of the global endometriosis groups that the researchers are part of, and there's all these protocols they have in place that I don't even know if everyone knows about because they don't have funding to spread the word. And so it's just like these silos of efforts. So I just wanted to share it. I don't know, like, if anyone had thoughts, but right now I'm just trying to gather intel to see how best I can help. And again, all of it hinges on funding, but yeah.
That's awesome. And that's wonderful to hear about. And maybe, I mean, if you do have a slideshow, maybe at the next meeting, you
Sure.
could present to us. We could talk it through more. Would that be
Yeah,
helpful?
no, that's totally fine. It's just a few slides, just giving the context and use cases I've seen. And if anyone here wants to fill out the survey, I can snap it into the link. I'm just, again, just trying to gather
Yeah.
information. And Heather was gracious enough to fill it out as well. So I'll just put the link here. And if you want, I'm happy to share, and I would love input from people because it is so overwhelming and there's so many great things. But just given my background in consulting, if we don't have like an endometriosis structure, it will take time to continue to move the needle. So
Yep. And we should all be building off one another and not recreating the wheel over and over
I know
again.
no one wants to do that. It's just like we're a resource constrained world. And what my observation is, like, just even when I spoke with the EndoRise team and just others, is, I'm speaking with people developing diagnostics and treatments, and everyone has the same issue, but everyone's doing it by themselves. And so it wouldn't be great if we can try to pull resources together. So I just wanted to share because I was very excited about Massachusetts as well. So
Fantastic. Thank you. Anyone else? Questions or comments on legislative update? All right. Well, that's a perfect segue, actually, into the next conversation, which I think I labeled next steps and discussion, which is pretty broad. But the goal there was so we missed a few meetings, and now, as this happens each year, I'm realizing it gets really intense during the legislative session. So we will likely prepare for that going forward, so that you know what, we're probably not going to have meetings for 2 months when that happens. But right now, the way the calendar flows is we've got a good chunk of time. So my intent is that we will meet in August, September, October, November, December, January. So we'll meet each month the second Monday of the month, 1 to 2:30. We will have to change our October date. I was just looking. That does happen to be Columbus Day / Indigenous Peoples Day. And so we will not have work that day in the state of Connecticut. But what we've done in the past, and I'd like to do, is we use the meetings as an opportunity to have presentations or conversations, discussions on important topics that we either want to shed light on and learn about as a group, or gather information to inform a policy ask during the legislative session. In Connecticut, again, to give the context, we will be heading into, in 2026, our short legislative session. And so it begins in February and will go until May. So wanted to use this opportunity for folks to kind of share, what should we be focusing on? What are some of the conversations we need to dive deeper into? It could also be conversations we've had in the past, but we should revisit. And so maybe to give some context, we've had presentations on fertility. We've had conversations about nutrition and how that relates. Insurance as it relates to endometriosis. So just some examples. But again, and that doesn't mean we can't revisit them. I always think it's important. Plus, things are ever changing. So it is important to continue to update ourselves and educate ourselves. So with that, I will stop, and truly, if you can use the raise hand feature, fantastic. If not, just wave at me and I'll call on you. But would love to hear your thoughts on what would be helpful for us to discuss in the upcoming months. Laura, go right ahead.
Hi, so this is something that recently I came across because I'm gearing up for a hysterectomy for adenomyosis. I already had my excision. So I'm just doing my regular baseline things that I normally do before I go through a surgery. And I did my cardiology appointment and I was explaining about endo and I was like, do you know about it? She said she did, but when I noticed when she was putting in the notes that that endometriosis, of course, did not even come up in her system. So what she had to do was put it as other / like abdominal surgery. So, and just literally had to put in the notes like she had endo excision. And then I was thinking about it and I was like, how much, because I used to work in healthcare also. So I was like, how crazy of a gap that is to have it in the system that it doesn't even come up and that it has to be like in another subcategory as other. And how complicated endometriosis is to deem it as other, like we kind of fall through the cracks. So I don't know if this has been talked about before. This is my first time coming to this meeting, but I think that is a major factor for doctors and hospitals. If it's not even in the system, how can we even fight to advocate and bring awareness when the doctors don't even know about it and don't even acknowledge it in the medical system itself, like the actual system? So I don't know what the process that would be, but to me, that's a major problem.
Great point and agreed. And I see Carol has raised her hand. Do you want to jump into this conversation, Carol?
Related to Laura's point, and thank you for sharing that, Laura. I expected that would not be the case. Silly me. But Laura's point reminds me of some research that some of you may be aware of that Dr. Jocelyn Fitzgerald at McGee Women's Hospital in Pittsburgh did, where for the first time she took surgical interventions performed on the male and female body and compared the reimbursement rates for those interventions. It's fascinating research. I can send it to someone here who could disseminate it if you'd like to see it. And so in short, surgical intervention on the female body is reimbursed at on average 30% less than that same surgical intervention on the male body. I feel like I should have fire extinguishers when I say that because I think it like lights people's hair on fire. I mean, it really, to me, that really encapsulates the way the female body is undervalued. And so to Laura's point, when she was describing that it was listed as other, I was like, of course it's listed as other because they don't care to elevate the condition endometriosis because financially it doesn't benefit them to do so. So they're going to put their resources towards those conditions and then those surgical interventions where the most revenue is generated.
Great points. And Dr. Luciana, please jump in.
To add to the frustration, it's amazing that research even got published. Dr. Barbara Levy, who was at one point the VP at the American College of Obstetrics and Gynecology, tried to write a paper and submit a paper to multiple journals with this data showing that we get paid significantly less. We get paid about 30% less to remove a lesion off of the labia than to remove a lesion off of the scrotum. So the exact same size lesion from the same area where skin is located, we get less money for it. She tried to submit this article to multiple journals. The Green Journal, the Journal of Obstetrics and Gynecology, which is supposed to be supporting all of us. And it did not get even accepted to be published. So they won't even publish the data, let alone let people know that we aren't. So even when we do the research, it's not getting disseminated, and so people aren't hearing about it, and that's adds to the silence about these, about treatment for endometriosis and any female conditions, because we just aren't we aren't even able to disseminate the knowledge other than through social media or, knowing someone who tried to write the article. It's really sad, especially for ACOG, because they're supposed to be the people that are supposed to be supporting us, right? Like they're supposed to be our advocates.
Do you
Wow.
have that article to send?
I think Dr. Courtois has now shared it in the chat.
Well, this is the one. Is this the one that Jocelyn? Yeah, this is Jocelyn's
Okay.
report and Louise's.
That's the one I referenced.
Yep. I was wondering about the one that didn't get published.
Oh.
Is it Dr. Luciano? Is that?
It still has not been published. I don't know if she's tried resubmitting it someplace else. She presented the data at AAGL in November of last year and submitted it after presenting it. And it did not get published. But I will ask, I can reach out to her and ask if it ever ended up getting published anywhere. I can also Google it, I suppose, and see if it ever did. But
was the doctor?
Barbara Levy, Levy.
Yep. Thank you.
But as of November, she had tried to publish it before presenting it and couldn't get it accepted.
Thank you both. Rachel, go right ahead, followed by Lisa.
Hi, so I was just hearing everyone talk about this. It seems like a huge theme is that we're stuck with grants and funding and kind of pushing the research aspect of things. Now, I'm new to this meeting, and so I don't know to what extent we've really discussed this. From my experience, this endometriosis and the whole journey started for me when I was about 10, 11 years old, and in the pediatric office. Sorry about that, Bing. And so I think a huge and crucial aspect of addressing endometriosis needs to start when we are young. And to that point, I think maybe an angle we could start taking could maybe be in our school systems with sex education. And I feel like when we were learning about just periods in general, like there's so much room to have more of a discussion on this. And if it's being brought up, since it affects so many women and girls at young ages, if they're aware of it at such a young age, it could be something that they can then start bringing to their pediatricians or their GPs, and maybe just start advancing the conversation early on. Again, I don't know how that would look, but I do think some sort of policy or advocacy towards that would be really impactful.
Thank you, Rachel. And we've discussed that here quite a bit. Needs to be discussed more. So again, thank you.
I'm sure.
No, but it's so important. And I am thinking, why don't we though? It'd be great to have a meeting on it, because then we could not only share resources that are out there nationally, but folks who have been doing the work locally here in Connecticut could speak to it. I know, and maybe that's what Lisa is going to jump in about, or other things, but also with EndoRise, they're doing a lot of intentional outreach to nurses, in particular school nurses. But agreed, like we need to keep elevating that. So I'm making a note that should be a great conversation that we have. Also have down what was said. Laura, again, thank you for bringing that up. I think that is crazy that it's not in the medical record. So if we can get some folks together to have that conversation and what it takes, to your point, to get those records updated. And then I think many of you know I'm always down for a very good feminist conversation. So this whole surgical intervention study piece is infuriating. So that'd be a great conversation, I think, to continue. Lisa, go right ahead.
Thanks. I have so many comments now as I was waiting to speak in response to everybody, but let me start with the overarching one, which is obviously I'm government communications with the Jackson Lab, but I part of the EndoRise team, and I beg you all to engage in a dialogue with us regularly as opposed to just when this group meets. We're always looking for what we're going to do next. We are engaged in conversations and have had some success with the Nurses Association in the state. We did an educational forum. We will continue to look to expand our engagement with them and how we can work in tandem with them, particularly in the school system, the school nurses, and opening opportunities there. But we really need to hear from you all with your ideas and concerns, and because as these conversations are happening, it's good to continually draw upon the expertise and the insights of this group. I was going to challenge us as a work group to maybe try to, I don't know if it's with creating some subgroups or how we would handle this, but it would be really great to have the Connecticut Endometriosis Work Group have a March event, an Endometriosis Awareness Month, and really have something where we can, I don't know if it's a forum, if it's a video, I don't know what it is, and maybe that's why I was suggesting maybe we have a subgroup, but that's always in session. So I think some of us who are wearing two hats kind of get sucked into the sessional stuff and can't always lead the charge of having a event at that time. So that's why I'm kind of throwing it out to all of the rest of you amazing women on this call. Because as I see, it looks like we have all women on this call to maybe consider what that event could look like and who might be willing to take lead on that. I mentioned, and I don't want to steal the thunder of the presentation, that we will be looking to do a fall event with the EndoRise program, but that's going to be focusing more on clinicians and researchers. So we are going to be having some of these more provider type conversations. So in relation to that, if you have questions or concerns or anything that you'd like to suggest to us, we bring up or have a discussion around, please send those our way, because we actually are starting to work on what that event is going to look like. Also, I want to re-raise my suggestion that we perhaps co-host an event with the Legislative Women's Caucus in the coming year, and maybe we can start talking about that now instead of when we're 6 feet under everything that goes on when we get into session, because I think that would be a great opportunity for us to really talk about some of the policy issues. Maybe it's after the legislative agenda is formed. I'm not sure. We can kind of scope out what that may look like. And then the last thing I'll say is to please also, in addition to your ideas and suggestions, please continue to send us resources that we can continue to publish on the EndoRise website. We don't want this to be a static site. We want to be able to promote this site as a place to go for information and to connect those in need with the resources out there, whether it be informational, whether it be medical, whether it be support group, work group, whatever it is. So we need all of you to continually try to communicate with us so that we can continue to do that. As you likely know, Dr. Luciano and Dr. Courtois and a lot of the science-y, I'll use quotes because it's not me, people on our EndoRise team are constantly involved in national, international conversations that are happening. And it takes up a lot of time and energy. So we really rely on the boots on the ground to also help feed us information, ideas, suggestions, and we love seeing you all at these meetings, but we really want to hear from you in between and keep that conversation going. So it was just kind of a blanket statement on that, and also to let you know we're highly engaged in continuing to work on stuff. So, and hopefully we can get some good forums and promotional opportunities happening in the year to come.
Great. Thank you, Lisa. Dr. Courtois.
I just want to say that, yes, I think we should do something around how Connecticut has been moving in the legislation and really doing this partnership and moving things forward. I don't know, maybe we should focus on a legislative-centered event for endometriosis that could also bring the other states that are trying to make some progress in this area. So I don't know, Virginia, Massachusetts, and others. I think if we can show that there is a unity across the states and that Connecticut is leading this, it would be great. So it would be a good topic for a meeting. And maybe Lisa, should we organize that at Jack's? Sorry you said it earlier, but
Yeah, well, I actually think that'd be a great conversation, particularly if we can get the caucus, the women's caucus involved to be able to have just a straight out policy conversation. And I know, was it Washington State was doing some interesting things, and I'm sure Heather probably knows some, and many on this call probably know people in each of these locations so that we can broach them in. But I think that's really an appropriate conversation. Happy to host it at Jack's, but I think maybe at the Capitol might be a little bit easier to get all of those policymakers there and engaged. Just my recommendation, but really excited to go down the road of having a conversation about what that could look like.
Fantastic. Thank you both. I'm taking notes, everyone. Representative Kennedy, go right ahead.
Thank you, Representative Gilchrist. And thank you to everyone, especially some of our new people on here. And I'm trying to remember, but I think we go back about 4.5 years now that this group's in a meeting. And when I think about where we were back then to where we are, I am so incredibly thankful for Dr. Couture and Dr. Luciano, because they've really brought us forward. But Rachel, you said something that really hit me hard, because Rachel, you're newer, and I don't mean to pick on you, but you said for you and so many of the women that we've heard from all along that this started with them when they were 10, 11, 12 years old. And so I just want to suggest maybe that besides our school nurses, maybe we have to involve like parent groups so that parent groups are aware, because sometimes often it will be like, you might dismiss. I know for me, when I was having issues as 12, 13, 14, kind of got dismissed because in that era, which I'm old, so that was in the 70s, people weren't thinking that. And something that you said about, the difference in what's accepted medically and what's paid for and what comes up on the cards. Endometriosis, we've made incredible strides, but I know we're going to do even more. And I know EndoRise is remarkable, but I feel like we need to reach parent groups as well so that they can say, gee, my daughter's been saying something, but parents may not recognize, they may not have even heard endometriosis. Most people, when you say it, they don't know it. So I just want to thank you, Rachel, for bringing that out. And maybe if we can get involved besides with our school nurses, because we were met with a little bit of friction with them the last 2 years and trying to get some training and whatnot out. And so we take it a step forward and bring it to the parent groups, parent teacher groups, and bring it that way. So I just want to mention that and just say thank you to all of you for always being on here. I can't let this group ever go. It's in appropriations, I did really fight really hard to make sure we got that money, and Rep Gilchrist, I think that money's coming our way. So I'm very happy. But I'll leave it at that. But I'm just so incredibly thankful for each and every one of you for always being here. And I just want to bring up that point. So thank you. Let me just drop my hand here.
Wonderful. Thank you. And I've added that I think engaging the parent groups would be incredibly important. I am so bad at names. Everyone who knows me knows that. So will I say iPad 74, I should know your name by now. I know you. I know your face. I know you have a daughter. But for the life of me, my apologies.
Beth Ludwig, Endo Mom. So speaking to the school nurses and maybe the PTOs, PTAs, do we have a program that we have that when we go out to schools to talk to the nurses, it's kind of a standardized program? And if we do, can some other people maybe be taught that? And if I can go to the school up the road, or 6 to 12 schools in my area, and get them to at least give us maybe an in-service day type of thing, where we could invite the parents or something like that. Is that something that would be doable, or maybe we could think about that and try to do something like that?
So I don't want to put Arlie on the spot because I know she's running around, but Arlie, are you available to share what you've been doing?
Hey, are you there? Can you hear
Yes.
me?
Yes.
Okay, yeah, sorry. Yeah, in terms of parent groups, I did an event in Bridgeport which attracted a lot of parents and people, and mothers are struggling just as much as the 10, 11, or 12-year-old to find the right resources in terms of women's health and out, doctors that believe them and understand what's going on. So I agree, like, we need to get parents to be more aware of this and more pediatricians to be aware of this, but I feel like we're kind of going in circles, because until we have more practitioners that understand what this is, we can rally parents together to talk about it and make more noise, but it's the parents were coming up to me with their daughters, and both of them wanted answers. And that's what I continue to get from people that reach out that are looking for help. It's like, well, I've been suffering with this, for 30 or 40 plus years, and now my 13-year-old daughter has it, and I can't watch her go through what I went through, but we still don't have the resources and the places to send them. I mean, the surgeons that are out there that are practicing, their waiting list for surgery is like 6 months. So it's like, we can continue to educate and bring awareness, but until we actually can do something that's going to change, like, the amount of surgeons that we have, I just feel like, and the surgeons like Luciano, like, they're inundated. So I don't know. It's sad, but that's what I've experienced, is like, I'm not just helping the daughter, then I'm helping the mom too.
And I guess the logistics of it, you got training, correct?
Yes.
What type of training did you get?
Well, in terms of the like the endo toolkit, I did all of their stuff online. And then the Women's Health Initiative, they also have their toolkit, so I've downloaded that. And I did go back to school and became, a health coach and nutritionist, which is obviously not certifying me for endometriosis or anything like that, but I think also just all of my own personal experience in working with different doctors and having gone through all of the nasty stuff that I've gone through in this state has just brought a tremendous amount of awareness to me in terms of how things work. And there's just so many roadblocks that I don't know how we're gonna to overcome them, to be quite honest.
Okay.
Arlie, can I chime in here?
Yeah, go for it, Rachel.
I totally see everything you're saying, and I completely agree that at the core of this, we need surgeons and they need to be accessible. I think where this discussion, at least for me, is kind of stemming from is in relation to what's happening kind of on the federal level, and how we, as you mentioned, we are in this like huge, like, we just keep, like, we're going in circles, we're hitting roadblocks. And I think when it comes to these like smaller grassroots efforts with Connecticut school systems and those things, I think that's an idea, and it needs to obviously extend far beyond that. But I think right now what we need to do is be making noise. I think we need to demand attention. And I think that's how we do it, by getting this. I think it's going to take a lot of time, but I think especially it's important to had this army of informed young girls and women and it's difficult because I mean, I even had to advocate um, to my parents and kind of prove myself to my parents and my pediatrician. And I agree with you. There are so many levels of women's health that need attention. Um, I think this idea for me stems from this needing to make noise right now. And I think that's an interesting idea on how we can do it, um, but not to diminish your fire or ideas and perspective at all. That was not my intention.
Yeah, no, but I think Rachel, you're right. And what I'm seeing, just not necessarily in endometriosis, but with other doctors or surgeons who are speaking out against insurance companies, who are speaking out about, what they're experiencing on their end, just being able to perform what they need to do for their patients, they're being punished. They're
Right.
being silenced, or they're, being told by insurance companies, well, we're not going to work with you anymore. And so I agree, it needs to be louder, but it needs to be bigger than just involving our schools. We need to really come together with other states and other organizations that are also raising awareness, somehow unify and make some serious change. Because I mean, Heather, you've been doing this for 30 years and not much has changed. It would be so unfortunate if we have another 5 to 10 years of the same sort of circles we're running in. But there's a lot of risk out there to speak up and to share the truth. And those people that are putting their jobs and their lives on the line doing that are taking a hit. And so I think that holds people back from also wanting to speak up because they're seeing what happens.
But don't you think those young girls at least would have some hope of like they're not crazy, and we could give them some resources and their parents some resources that, this is real, that, your daughter is not making this up, at least we can give them that if
Yeah, I agree. I totally agree. It's just hard because at the end of the day, I'm telling people, okay, yeah, your daughter's not crazy, you're not crazy, but where then am I sending them to get like the support and the help that they need? And then if they don't have out of network benefits, or they don't have insurance or access to these things, it's like a devastating, diagnosis to be given, and to be told, like, well, yeah, your daughter has this, it's real, but we don't have any other resources to provide to you to help. I don't know, I feel like that's just been the conversation that we've been having for a while now. And I would love not to like throw UConn or any of these large, institutions under the bus, but like we need their support. Like they're raking in billions of dollars. Like where are they in terms of standing up and backing us in terms of this fight? We need that. We can't just continue to do this at like the little level that we are. Like we need more noise, we need more support, need more states to get involved, just like everything that's happening, with menopause and getting testosterone covered by the FDA. And, we need to join forces with all of those other practitioners and people who are speaking out and are really trying to make change, in my opinion.
Well, I hear two pieces coming out of it, and I totally validate what you're saying, Arlie. And um, yeah, you're bringing me back to actually, I don't know, some people know my background is I was a sexual assault crisis counselor, and it can be frustrating when you want to give people options and then it's like, well, yes, if you report to the police, well, I don't know if anything actually is going to happen with it, but we will support you in that. And that's what, maybe it's a weird comparison, so I apologize for that, but that's what it's bringing up for me, where it's like, okay, so yeah, like you share this information, but it is incredibly, back to Beth's point, like it's powerful to validate someone, and to be validating this child and this mom is needed, right? And then how do we help get them to at least some information? And I know you are doing that, Arlie. And so I'm seeing kind of two conversations. I think a next step conversation would be having this conversation about, like, it's kind of a bunch of folds, but like if we want to focus schools, so parent groups, school nurses, sex education, what does it look like to have these conversations locally? And then what are the resources we can give, right, at this point in time?
Right.
And then another conversation of like, maybe we can get some of these, and I'm going to need folks' help, but some of these bigger advocacy organizations, like invite folks. This would take a few months to get everyone on everyone's calendar. If we could get various states who are talking about this, national groups, and really structure and have a conversation here, this could potentially help what you're doing, Georgie, right? Like this could also like really help us to have this bigger conversation on like, how do we collaborate to push? How can we support? Who is doing what, to try and push the needle?
How do we get all those other doctors, that are out there? Like, we talked about an event in March. Like, that would be amazing if we could, somehow create an event where we pull all of these different specialists together and all of these people like that are trying to push the needle and make change. And I'm not saying that like not giving parents or, like obviously we need to validate. I guess I'm sort of at the place where I'm frustrated by, just validating. Like I want to provide a parent an answer with, okay, there's this pediatrician that understands endometriosis and like they take your insurance and this is where you need to go. I guess I'm getting frustrated with just not being able to really give people more than just validation.
Yep. And I hear that. I understand that. And I think we all share in that.
Sure.
But I think at the same time that we're pushing, right, this is kind of what we've always had to say at this group, which is frustrating, but that's the way this work works, is like, we've got to be doing this while we're continuing to push for that bigger change, because the more people we can bring to this work and at the same time truly validate that you are not crazy,
absolutely.
Georgie, followed by Lisa.
So thank you for calling on me. Just listening to the group, going back to what you were saying, I think Arlie, you had mentioned it about menopause and testosterone. So the difference with menopause is that it is very clear what to do. And so because of that, it is a lot easier for movement to happen there. But then you have things like Alzheimer's, which disproportionately impacts women. And now, like Dr. Lisa Mosconi is putting together a coalition to align her researchers. The challenge with endometriosis, because I work with a lot of industry folks, whether they're developing diagnostics or treatments, is they can't, when they do market research, there isn't even a consistent patient journey. And so it's really, so we don't have a consistent patient journey, right? There's, the experts themselves, in my observation with the different people I've interviewed and just people I've spoken with, seem to disagree on what needs to be done. The diagnostic, I hear, yes, you can do it through imaging. No way you can't do it through imaging. Laparoscopy is the standard of care, but no, you can do this instead. So there's so much disagreement even amongst the community. And so if we don't have a consistent patient journey, the community doesn't agree amongst themselves. And I'm not going to get in the debate of what is or isn't right. And then you have things like Organon's phase 2 trial for the endo drug did not make it. So now that's going to scare investors possibly in investing in endometriosis. So we have all of these things that are very, very real that can drive progress, which is why we need to put structure in place. Like, what are these patient journeys? What can we do to get experts to agree on something that will move the needle forward? Like, for example, a biobank. If we can all create what EndoRise is doing with the biobank and have more biobanks available for more testing instead of each group trying to create their own. So there are just things that we need to do in a unified way to move progress and also not have only 10 surgeons who know how to do the surgery properly. We need more. So until we know the gaps, there's just a lot of spin around the same story. And so that's my hope, is that we can get that. But that's why, Arlie, you're seeing with menopause, it's moving more quickly.
Yeah, thank you. Because I do understand the difference in that, and I think your point about menopause and the risk of dementia or Alzheimer's. I mean, one part of endometriosis that I really continue to like to see highlighted is the effect on people's mental health, and that's definitely not discussed enough. I don't know if there's a way that we can go at it from that, since mental health is more highlighted, but it's just such a drastic effect that it has, especially if you've had a 5, 10, 15, 20-year delay with no one believing you. But I understand what you're saying in terms of the difference with the menopause. So I appreciate you saying that.
Great, thank you. Lisa, followed by Dr. Courtois, followed by Laura.
Thank you. Just one quick comment, because I unfortunately have to shift to off of my view for the rest of the meeting, and I do know there's a presentation we need to get to. Two quick comments. One, this conversation and just all of the interest and passion being shared right now is exactly why we should turn into a like a committee, subgroup, work group model, so that these conversations could really be had and fleshed out and recommendations can be advanced. But two, speaking to the medical group, obviously we're looking to turn our attention to that with the conference that's coming up. But I'm also will be suggesting that we outreach to the Connecticut Medical Society in the coming months or in the coming year, and start to have a dialogue with them over how we might be able to do some educational, well, I won't say educational, their physicians will give them the benefit of the doubt, but some programming with them around reaching their membership, and perhaps even partnering with them to speak both to their members, but also to perhaps touch upon some of their patients and their communities to try to advance some programming and some information out there. So thank you all. I have to disappear for a little bit, but do continue to outreach with your ideas and suggestions. Thank you.
Great, thank you, Lisa. Yes, Dr. Courtois, and then Laura, and then we will need to move on to the EndoRise. Okay.
Yeah, I just have a quick comment. I think this is a very, very valid point to be enrolling younger patients in studies, or at least to try to understand how endometriosis in adolescents is starting, but also different from older patients. So to that, we've been trying. So as a researcher, this is something that I deeply care about, but it's very difficult to access gynecological biospecimen from patients that are under 18 or even 16. Extremely complicated. You don't have easy access to pediatric gynecologists. And with Danielle, we've been trying to work with different institutions. So UConn doesn't perform surgery unless it's emergency, but Danielle can talk about it way better than I. So for research, from a research perspective, it is critical that we start looking at the disease in the early steps when it starts in a 14, 16-year-old but it's very difficult. So I think we have to start talking with other clinical institutions, and this is what we're trying to do with EndoRise, try to enroll. So CCMC, which is based in Connecticut, and probably in the future we should look at other ways to get to those younger patients, but it's not easy. So there is a lot of structure that needs to be put in place to get to those patients, to understand the disease, and to educate more providers.
Great, thank you. Laura?
Just a quick comment, just because my sister is a cancer researcher, so she's known, obviously, my journey with endo since as young as middle school. So when I tell her a lot of these things, she's like, it's so strange because it acts just like cancer does, or very similar. And you know, it's usually around, it correlates, it almost mirrors the same protocol as her cancer research. So I was like, so our thought was maybe somehow we can piggyback off of like some big cancer institutions, you know, and see if it would be something that they would be willing to discuss, like we're like the silent cancer or the non-deadly cancer or something, just to bring more noise to it and have something as big as the Cancer Society back us in that way. It's a stretch a little bit, but certainly not that much. But it's just another opportunity to maybe push the story forward until we can stand on our own 2 feet by ourselves. I think that might be a great idea.
Great point. Thank you. Thank you very much. All right, these were all fantastic ideas. This was a wonderful conversation. I appreciate you all so much. So I'm going to take these notes and then start to build out the structure for the next all the meetings coming up, and when we can have these conversations and presentations at those meetings. 2 quick things before we jump into the EndoRise presentation. Marge, not to call you out, but I know you had to jump on late. I don't know if you heard the news that Massachusetts legislature is right now working on 2 bills that would create their own endometriosis task force in the state of Massachusetts. Just want to flag that for you. Good news. And then these conversations made me think personal privilege. Many of you have gotten to meet my daughter at this point in time. She is now 13. But she has brought up endometriosis in her 5th grade conversation about sex ed. She has brought it up in health classes in 6th and 7th grade. And it took watching 2 movies and attending like 2 events. She is completely comfortable having the conversation. So I do think there's such value when we give young people the information, because to just see how, to her, it's second nature to be able to discuss it is fantastic. So I thank all of you for that, and vicariously her friends, because she really is kind of this little endo warrior walking around telling people what they need to know. So thank you all. All right, with that, I will turn it over to EndoRise.
Okay. Can you all see my screen?
Yes.
Okay. So like I mentioned earlier, I'm Yasmin, I'm the program manager for EndoRise, and these conversations actually go really well with what we're going to be talking about today. Over the last few months since our meeting, since the last endometriosis work group meeting, we were really involved in community outreach and trying to bring awareness and working on that piece of our program to build awareness to endometriosis. From the last meeting and some of the social media website, we talked about meeting with the Connecticut Nurses Association and being part of their virtual convention to talk to the school to nurses that were part of this virtual convention, to present on endometriosis, to talk about our program, and really try to shine the light for the nurses on endometriosis. We had a really great turnout. There were school nurses, emergency department nurses, at-home live-in nurses that attended this convention. So Dr. Alexis Newmark, she's the minimally invasive gynecology surgeon at UConn Health Center and an endometriosis specialist. So she really shined a light on endometriosis from the clinical perspective of it, and really tried to emphasize the debilitating effects that endometriosis has on patients, young patients, and working with the nurses to talk about some of the major symptoms that can be present, especially with the young students, that a lot of times the nurses are the first point of contact for some of these menstrual pains that are so widely normalized. Like I said, we of course talked about an End program. So we're always in touch with the Nurses Association, and we really do hope to do more of these events, just to, keep working on that endometriosis and that education and awareness piece. But we did receive really positive feedback, which we all know that nurses are really overworked, and there is a wide nurse shortage currently in the nation. So we were pleasantly surprised with the turnout of this event had, and just from the post-survey results that was shared by the Connecticut Nurses Association, we see that post endometriosis presentation, 97% of the nurses could discuss at least two aspects of endometriosis and being able to identify symptoms related to endometriosis, compared to the 71% prior to the presentation. Like I said, this was really a great turnout, and we definitely will be working with them again. As a matter of fact, we were invited to their volunteer recognition dinner, which was just nice to be part of, and they were really grateful for our Endorise team that we were able to allocate some of our time. And through this virtual seminar, the nurses did receive continuing nursing education credits. So that's just a little incentive for their attendance through this program. In addition, we actually held a screening of the Below the Belt documentary with the UConn Physiology and PNB Society at the UConn Stores campus. So I'm not sure if everyone knows what the Below the Belt documentary is, but it's a documentary following the journey of a couple different individuals with their experience from endometriosis, through their daily quality of life decreasing, to the struggles that they had with insurance companies, and just being gaslit in the medical field. So we had this was an event tailored to students. So rising upcoming medical professionals, some of the students that may have endometriosis or think they have endometriosis, and just the general public. We had about 60 students show up to this event. It was an event really late in the evening, so we were really glad with that turnout. We had post the screening, we had a panel discussion. So like I mentioned, Dr. Alexis Newmark from the mixed department has really been involved with us with this education component from the clinical perspective. We had Dr. Luciano, who's here today, Dr. Courtois, Arlie, thank you, Arlie. And we also had Dr. Alyssa Iskovich. She's a physical therapist out of Vernon, that's focusing on pelvic health and working with endometriosis patients and postpartum patients, to really focus on the pelvic health symptoms that are associated, pelvic health symptoms that are associated with endometriosis. So this was actually one of my favorite, and I think most impactful presentations that we did so far. This was a partnership that JAX has with the Connecticut high schools. It's part of the Teaching the Next Science Generation. So a teacher from South Windsor High School, she's a science department teacher, Debbie Tebbets, reached out wanting us to talk about some of the science that we're doing. And we really jumped on this opportunity to highlight the science and the technology that we're using in the lab to study endometriosis in particular. It gave us a chance to talk to students about endometriosis, to highlight what endometriosis is. Some of the students obviously, are affected by endometriosis that were in these courses, and some of them had no idea what it was. So it was a great opportunity for us to talk about the science and the research advancements that we're making, not only in our lab, but nationwide, but also to really shine light on the disease and the program that we have in Connecticut. We did get really great feedback from the teacher and the students, so we're looking to partner with her again next year, this upcoming school year, to do more of these outreach for the younger generation in high schools. With that, so the World Endometriosis Society held a World Endometriosis Congress conference this past May. It's a global platform for researchers, healthcare providers, advocates to come together as one to continue to talk about endometriosis, to share what they've been working on in the research component of where we are and the advancements that we have made since the last Congress and everything that's happened, that's kind of happened with all the funding and everything, but also to talk about the clinical practices, to provide recommendations on the improvements that could be made, and what the healthcare system is doing to hopefully, or what we can do in the healthcare system to support endometriosis patients better. But then also there was a lot of effort, discussion about advocacy efforts and building that health equity gap that we're seeing not only in Connecticut and the US, but globally, and trying to really come together to address those issues. So there were about 1,100 participants from over 60 countries at this event. And luckily and deservingly so, I would say that we submitted an abstract from the Endorise program, a multidisciplinary endometriosis program that's empowered by community outreach and legislative advocacy. And that abstract got accepted, and we were invited to do a poster presentation for about our program. It was very well received, and we're really happy with that, with the way everything turned out. This conference really also highlighted the continuous need, drastic need that we need to be fully invested going forward, even more so than the last few years, to push forward on recommendations for different research priorities as the field is evolving and as we are learning more about endometriosis, to shift those priorities in the right direction, to continue to identify unmet needs of patients in the healthcare system, education on endometriosis, not just for public, but of course the healthcare providers, and how that can have a different shift, and how we can connect those dots between the patient and the research and the healthcare system. And of course, like I mentioned, the clinical practice, the interdisciplinary versus multidisciplinary care. So instead of having 5 different doctors that you're seeing individually, and those doctors never really get on the same page about your treatment, building those networks where you're meeting with all those multiple physicians from different specialist areas at the same time, so everyone's on the same page, and hopefully will lead to a diagnosis of endometriosis and better care, rather than seeing everyone individually. So that was some of the key takeaways from this. We are, still we have these connections and these network that we're able to share our research and kind of, work off of each other, kind of, what George you mentioned earlier, instead of working in silos, really making sure everyone's on the same page, and sharing what we know and what the advancements we're making, so that we're all working together toward one goal, and that's really to educate on endometriosis and hopefully non-invasive diagnostics that we always talk about. We also had a great opportunity this summer to host 2 students through the UConn Health Career Opportunity Programs. So this program, HCOP, is UConn partners with different laboratories, institutions, to provide opportunities for students that may, in the healthcare field, in the medical field, research field, that may otherwise not have access to them. So from areas that don't have access to these programs, to the opportunities to really excel in the field, whether that's based on your family history, the education background, but it's really exciting. We have Meryl and Natasha in the lab with us this summer, and where they're both doing 2 separate research projects on endometriosis, that they'll be presenting actually this Thursday at the UConn Health Center Rotunda, where they created a poster about the research projects, the hypothesis, the results that they came up with in the lab. So it's been really great having them here. This program was funded by UConn Health and the HCOP program. So we hope to be able to do something like this with Endorise in the future, where we're able to sponsor students and that can learn more about the research and endometriosis, and be involved in the process. I do want to highlight that Natasha is also working on a pamphlet for middle school students, that she'll be able to distribute. We'll work together with some of the schools to help distribute and introduce into the school systems. With that, I do want to share that we did send out some pamphlets, the Endorise pamphlets that we made from endometriosis to the Stanford Community Center, Youth Community Center, that was then distributed to the school nurses and students in classrooms. And they were using those pamphlets to for some of their projects that they were using. So they were making posters and sharing those flyers throughout schools. So I think that's one step in the right direction of kind of that education piece without really changing the curriculum that we all know it's so hard to do in the school system. So that's some positive news. And if you guys want to learn more about Meryl and Natasha, they are on our website and on our Instagram. So funding update, like we mentioned earlier, the 25 to 27 state funding, really the goal of it is to continue to support the operations of the endometriosis biorepository and data bank, hopefully continue to expand and work with other healthcare institutions in Connecticut to expand access to enrollment, study enrollment for the biorep, and potentially even working with CCMC to really to try to enroll like younger populations into the study. And of course, increase promotion and endometriosis research. That's one of the big things that we're always working toward. In addition to the state funding that we apply for until hopefully we're fully self-sustained in the coming years, and we can build that our biobank and distribute the specimens in the way that we envision. There is a Cigna Foundation grant application currently open. Actually, I think it just closed for a Health Equity Impact Fund. So this grant process, or the goal of this grant, is to really try to provide access to those underrepresented, underserved communities that may not have transportation access to healthcare visits, primary care providers for basic medical needs. And we thought this was a great opportunity for us to really focus on increased community awareness and education events about endometriosis. So whether it be through public libraries, schools, community health centers, to really try, and this is an event, I'm sorry, I should have led with that. This project would be based out of Hartford. So focusing on that underrepresented, underserved community, I should say. And part of our proposal is at-home collection kits for study enrollment. As we know that, not everyone has access to the healthcare system, making it a little easier to have their equally represented in these studies that are going on. The at-home self-collection kits would make that burden a little less burdensome, but also having phlebotomy at-home visits for the blood draws that we would be having. And we also discussed if this, doing some pop-up tent events where we have, educational materials and, a clinician there to talk about endometriosis and raise awareness for just in general community set events that we could really bring attention to endometriosis. And I think for this grant application, the announcement should come by October if we move on to the next step. An update to the Endorise biorepository. So we have 70 total participants enrolled, over 3,000 specimens that we have biobanked. We're still working up to those, crucial numbers to be able to start distribution, and we're working on some of the final paperwork to be able to start distributing specimens for research, for basic research. And we did start seeing participants from their initial visit as follow-ups this coming year, over the last few months. So the follow-up surveys and the visits are currently in progress from the initial participants. As we all know, this is a longitudinal study, and the patients come back yearly for a blood draw, and also we collect survey results on their quality of life and clinical data that we are building part of the biorepository. And as always, connect with us on social media. We try to keep our website up to date, our Instagram up to date, some of the events that we have going, some of the activities we've been involved in, the research that's happening. But yeah, thank you all very much. Any questions?
Thank you so much. It really is always so impactful to see what you all are doing. So thank you.
Thank you.
Any questions from the group? Okay.
question. So if Endorise has some relationships with schools, how did they get that, and can that be a segue into educating schools?
Yeah, a lot of the honestly, the relationship that we do have with the schools has been with the outreach that we have received. We've obviously tried to connect, but I think like we always talk about like getting into the schools is very hard, just because the disruption of the curriculum and just their overall planning the day. But this has been really, I think it's helpful for that the Jackson Laboratory has that connection with the school system to teach that the next science generation. But we are working with someone like the community outreach and folks in those school systems. And that's how we were also able to do some of the school education that we did in Stanford, that we did in Meriden, school education for the nurses. So we're really trying to kind of build off of those segues to get our foot into those schools.
And Beth, I can follow up with EndoRise, and for that presentation we'll do, I can have them share more about what that looks like building that communication could be helpful. Awesome. Well, I like to be respectful of people's times. This was a really great meeting, a lot of fantastic conversations and information. We are at 2:30. We are going to meet again in August. And so please mark your calendars for August 11th, 1 to 2:30 via Zoom. We'll get that calendar invite out to you. But thank you all so much. And in the interim, if other ideas, or you're just not a sharing a group space kind of person, if you have other ideas on things you'd love us to discuss in the next few months, feel free to email those over. All right. Thanks everyone so much. Have a good one.
Thank you. Bye.
Thanks, everybody.